There's these severe hemoglobin disorders, which essentially result from a mutation, a single mutation, or from a variety of mutations that inhibit the production of adult hemoglobin. So we're either severely deficient or we have a structural defect in adult hemoglobin. And so the structural defect is what causes sickle cell disease, and the deficiency is what results in beta thalassemia. We're interested in doing is looking at reintroducing a gene into the patient's own cells, and these are the hematopoietic repopulating cells or hematopoietic stem cells, and these cells give rise to all blood cells. So what we envision is that we can use a virus that is very efficient in delivering genetic material into these types of cells to introduce a gene that's normally shut off in adults. But it's highly active when we're in mom, so when we're developing during the fetal stages of life. And this gene is called gamma globin. Expressing this gene that has now been shut off and turning it back on, we're able to correct the defect in adult hemoglobin. St. Jude is located. There are about 1,800 sickle cell disease patients. So these would be young children, adolescents, teenagers, and young adults. So the target population that we're interested in is going to be this group. Kids that are between the ages of 5 and 18. In our proposal, what we will be doing is taking the patient's own cells. So there's zero chance that they will reject these cells once they're put back in. And so you don't have to use these strong immunosuppressants to keep the body's normal defense system down so that it won't reject these cells. They're normal, they're natural. So that's the idea. I think that this would be life-changing for all of the kids, particularly those that have the most severe forms of the disease, where they have severe pain associated with frequent transfusion, and they have no identified donor material that they can use for hematopoietic transplant. For them, we have the opportunity to treat them one time and cure them for their entire life. So they'd never have to experience the symptoms, the pathology, the organ damage that's associated with this disease. And instead of having a life expectancy of 40 to 50 years, they would have a life expectancy of 80 to 90 years.